Hey, welcome everybody. Today we're going to be talking about hip joint pain, arthritis. It's just kind of the not fun stuff that can happen to our hips. I'm Reagan Archibald, your host. I've got Annie Asher with me,
Hey, everybody.
and so glad to have you here. If you guys have ever had hip pain, one of the worst things about it is when you're trying to sit down or you're trying to lay down. And probably, in our lifetime, about 25% of our time or more, up to 30%, is spent in bed. And so it's a lot of time. It's high quality time for me, anyways. I really appreciate my sleep. But then if you look at it, unfortunately, about maybe 50% of our waking time at least is spent sitting, and some of us it's like 90%. And even worse, there's certain of us, certain Americans, who it's like 95%. So the hips are a very pivotal area in your body. One of the things my sensei, Daiichi Sorimachi, used to talk about when he talked about the hips is like our spiritual pivot. So when your hips are healthy, when they're robust, you feel powerful. You feel like you're able to take on life's challenges. You can run fast. You're upright, so you have more of a spiritual connection. When your hips get closed off and really tight, you lose flexibility. It affects your center of gravity. You don't feel grounded. You're disconnected from, people around you, or disconnected from your own life. And so the hips have always been kind of this fascinating area for me. And I find that whenever my hips get released, if I'm doing acupuncture, getting trigger point injections, even doing some body work, it's just this nice, just a nice peaceful feeling that comes over me when I've got loose hips. So, Annie, have you ever had hip pain?
I have had hip pain, and I want to expound on what you were just talking about. So I do a lot of yoga, as you know, and my yogi teachers, they're all amazing. But when we do the deep hip work, they also say you store a lot of your emotion in your hips. Like when you're worried or sad, it kind of tends to fall into that little center of gravity for you. So when you're doing those hip exercises and opening them, it can be really cathartic. Like I've had people in class cry their eyes out when they open them up. Like it just shows how much you use a certain area and how it can affect your overall body. But yeah, I've had hip pain and I've suffered from that, and it's something I work on a lot in yoga, just from overuse of sports and things. But I tell you what, when my hip is out, everything feels out.
Yes, yes. It's crazy, isn't it?
Yeah.
Because your center of gravity is right about 4 inches, 3 to 4 inches below your belly button, and that's your hips are everything's resting on that. And your hips are a very mobile joint, so having pain there, it affects your walking. It affects your ability to squat down. So one of the healthy measurements that we do is, can you squat all the way down and stand back up? And if you're even healthier than that, can you do it with one leg? And so all depends on the hip. Everything flows from the hip. So if you look at kind of the overall anatomy of the hip, first of all, you've got the largest bone in your body. It's called your femur. And at the top of the femur is your greater trochanter. It's that big kind of bony mass. And if you guys want to feel the side of your leg, you can kind of feel that bony mass. Some of you, when you get hip pain, you can get bursitis lower in the hip, or you can start getting arthritis right where it's called your acetabulum. That's where the greater trochanter, the head of your femur, it fits into your hip socket. And in a lot of cases, this is where our patients start to notice that they get arthritis. And then in the arthritis, once the arthritis sets in, then there's inflammation, there's pain, it's harder to move around. And then once again, usually it's a steroidal injection into the area. And then past that, it's a total hip replacement, which much better than it used to be. But what we're finding is, with stem cell therapy, you can actually regrow some of that cartilage that's been damaged in the hip socket. And we'll show you this as we move on. But as you look at the anatomy of the hip, one of the big areas, some of the big muscles that wrap around the hip, of course, your glutes are connected to your hip, your obturator muscles. But then you've got this big old muscle called your iliotibial band. And when you start to have your hips becoming arthritis, when that cartilage starts to go away, then that IT band gets more contracted because it's trying to protect your body, and then it can actually cause more knee pain. And which is very interesting. And we've actually had patients who have told us, I want to get my knees injected with stem cells first, because my knees are what bother me the most. And then we inject their knees and their knee pain goes away. But their hips was actually what was causing the knee pain to degenerate so quickly in the first place. So, it kind of starts from the root. If you look at a tree, it's got its root systems. The hips are the roots, and then your peripheral joints like your ankles and your knees are all dependent on your hip health. So the IT band can be one of those bands that gets incredibly tight. And I've had massages on my legs before where I've almost been in tears because it hurts so bad.
I was just going to say that. My husband recently did a neat, just structural alignment massage round with a friend. And she did his IT bands, and he cried because they were so tight.
It's
You can't kill me for sharing that, but it's true. I know it's painful.
Forgive us, Josh, but
Sorry.
yeah, it is one of those things. And if you do a couple, there's some movements that you can do. One of the things we're looking at is how much arthritis is built up into the hip. Some of you may actually have a contracture. So in certain cases, you can have certain bones that are fractured in your hip and not even know about that. That can cause more of a stiff hip joint. It limits your range of motion. You'll have an inability to position your joint in a neutral position. One of the easiest tests you can do is you can just tap on the bottom of somebody's heel with their leg straight, and if they've got a fracture in their hip, then they're going to feel pain when you tap on their foot. And many of you who have had arthritis, or maybe you've been diagnosed with osteoporosis, or you've been on like omeprazole or another proton pump inhibitor, you're going to feel you can have some issues going on in your hip. This is what it looks like. You just hold the ankle and you just kind of pound on the ankle. Wow. Very simple procedure. It's called the Anvil test. One of our patients who, we treated probably close to 100 different hips overall at East West. But one of our patients, the one that we'll talk about, she was expecting to get a total hip replacement. Lived in New Jersey for most of her life, and she'd had a lot of falls. She was in gymnastics when she was a kid. And basically her doctor told her the only solution is going to be a hip replacement. And so she didn't want to do that. I don't know anyone who wants to do a hip replacement, but I told her, I said, well, it's a lot better than it was 5 or 10 years ago. The technology is incredible. The skill of the surgeons is amazing, but it's still risky. And the problem is once you have a hip replacement, we can't really do stem cells and regrow that. And so she decided to go through with the stem cell therapy. This was right before ski season. So it was last December. And she had both her hips replaced. Within a month, she's back skiing, better skiing than she's ever had. Oh, sorry. Before we did the injections. Yeah.
You got it. Yeah, so we injected them.
Yeah, we injected it. Excuse me. We did the stem cell injections. And a hip's a bigger joint, so not the easiest joint to inject. But we're very skilled at knowing exactly how to get the needle into that articulation, using ultrasound, bony landmarks. All those things can be very helpful. But once the injection took place, she could feel the fullness in her hip. A month later, she's skiing. She's doing full squats. And this was a lady who, she was in her 60s, but she was walking like she was an old woman. Like she had no flexibility there. But the coolest thing about her that I saw is, how we talked about kind of that more awakening, the moving more energy in your body, just feeling more alive when the hips are open. She felt like better than she had in 20 years. And it wasn't just from the hips. I think it was just, for some reason, the hips are just that spiritual pivot area in the body. And, she just felt nicer. You could see her face. She looked happier. Yeah, really cool. Yeah, that's great. So hip replacements, big deal. By 2030, this was from the changes, a document that was put together, government document, changes in surgical loads and economic burden of hip and knee replacements in the U.S. So it's by 2030, the demand for hip replacements is projected to more than double. The cost for a hip replacement, each hip is anywhere from $40,000 to $70,000.
Wowza, that's so expensive. And what are the statistics on a hip replacement? Do you know, as far as like healing or risks of surgery?
Hip replacement, the risks of surgery, it's similar to a total knee replacement, where about 1 in 400 people actually have complications to the point of death. Either they have blood clots following the surgery, they can't breathe, or usually it's from an infection. And so, it's not always safe. Another big risk that I see is, our medical establishment, and primarily this is the pharmaceutical companies to blame, but with the narcotics that we have on the market right now, and it's gotten much better than it was in the 90s or 2000s, but doctors were considered inhumane and uncompassionate if the patient had any pain whatsoever. And so what we see is a lot of patients, their brains get accustomed to having these narcotics that they were prescribed after their surgery, and then they get addicted to those narcotics, and it's a downward spiral.
Right. Yeah, we've seen so many patients come in, facing that road, who are probably a little overly dependent on their narcotics and just don't know what to do. And so those patients can be a little harder, because we have to look at stem cell therapy, but also make sure that we are treating their bodies so that they can handle the transition of, going off of all those medications and actually restoring health to their body.
Yeah. Yes. And so I think, that's a risk that we don't always look at. But I want to show you just an image. This was a patient of ours. Many of you are just listening to this. If you want to see some of the images, you can go to our YouTube channel, East West Health. But you can see this patient we had. She flew in all the way from Argentina for two reasons. One is because the surgery, she wasn't a candidate. She was 85. They told her she's too old. It's too risky. The other reason she came out here is because the stem cell procedure, same thing we were doing in Argentina, was $25,000. Wow. And so she flew in. I did her initial assessment, and she failed the strength test. Her mobility was very poor. Basically, she tested positive for all of the findings that would show, severe arthritis. She brought in her image. We could see it. The way she was walking with that left hip, she kind of she had to drag her leg along. And I was not sure. I told her, it's a 50-50 shot. I think this can help. But I don't know, because her hip, she had no ability to even raise her knee up. And so she said, it's my only hope. So we did the procedure for her. Dr. Lawrence injected her up at the Park City Clinic. 5 weeks after the stem cell injections, I did a re-examination on her, and she'd had acupuncture along with that. She had no pain. She had 80% improved range of motion, and she passed the strength test. And she was so happy. She was crying because she wanted a solution for her hip. And you can see 6 months later, she went and got another image. You can see the arthritis is virtually all the way gone. She's got a nice little space there in the joint, and that allows for much more flexibility and mobility. But she was able to reclaim her health and reclaim and restore her joint function, and is doing much better now.
That's so awesome. That's one of my favorite things about being a part of this medicine, is we see so many people come in hopeless or non-candidate for surgery and just in all this pain, and then they come in and we can transform their lives, and you see those tears of joy, and you see these successes, and it just makes us want to fight harder and do better, and just, yeah, this medicine is so much fun.
Yeah, it's beautiful. And, one thing we do is we really pride ourselves on finding out how we can just really increase the outcomes of the stem cells. And so that's where nutrition, where we use acupuncture, there's certain therapies we're doing post-care so that you're not just getting injected and just hoping the stem cells work. We're actually doing things to facilitate the growth of those cells and the overall function of your body. So if you have hip pain, arthritis, if you're looking for a different solution that's safe, surgery-free, natural, that's the clinical results have been very, very phenomenal, then give us a call. The office number here at East West is 801-582-2011, and we can't wait to see if we can't help you. Any last words from you, Annie?
Yeah, if you suffer from hip pain, just definitely get a hold of us. Go on our website. We've got a ton of testimonial reels. We have a ton of talented staff who work here who can answer all of your questions, and we hope you look for a brighter future because we may have one for you.
Beautiful. Thanks, everybody. Have a great afternoon, evening, morning, whatever time of day it is.